Hey guys, welcome back to another podcast.
Welcome back.
Yes. And as you can see, we're still in the sports spirit. He's representing FIBA, and I'm representing the
Philippines.
Matildas still.
Laban Pilipinas! Pusa!
Regardless if they lost, but then, it was a good run. Good run for the Matildas. Right, so our topic for tonight, wala na paligoy-ligoy pa. We're just gonna get to it. So I think it's timely and more relevant to us, like who's actually starting a new workplace in a new environment. So the topic is gonna be, what do you think about going to work as a new starter, or like technically new starter in new workplace? Are you gonna go to work with your cup half empty or half full? When I say cup, that means your knowledge, like theoretically. Are you gonna go to work doing doing things like you say, oh, I know what I'm doing? Or are you gonna just observe or just restart and reset what your experience for
Am
a
I
little
going
bit?
first?
Yeah.
So I guess the last thing that I would want to do starting in a new workplace is come out as being knowing everything, like coming out arrogant.
Yeah.
I don't want to come out as that. Like, of course, you would have like your experience as your experience from the past. Your new workplace is a new setting. It'll come with their own protocols, their own routines. So you can't assume that everything will be the same. So yeah, you need to learn the ropes. Start as a rookie again.
Yep.
Although your experience will come into factor later on as you learn how to do things in that new workplace.
True. For me, I think you just have to balance it out. Like, you won't come off as stupid,
Yeah,
like
definitely.
not knowing anything, or someone who's also like a bit showing off, like an arrogant, what are you doing? Like, but I think like just in a humble side, just as you said, learning the ropes. So
How
it
did you
takes
go?
time.
How did you go with your new workplace?
Oh, well, I think I turned out to be okay, because I don't want to come off as I know
Yeah.
the whole thing. I mean, look, I know dialysis. I worked in dialysis for a long time, but I want to respect that they've got these new guidelines and protocols that I need to learn,
Yep.
and I need to do it in a proper way that abides by their laws, because at the end of the day, whatever I do in that to that patient, or to like with my work, is going to reflect on how they're going to be in their principles and guidelines, isn't it?
Yeah, but then was there a scenario where like your hiring manager like obviously shared this information from the old staff that were there, that we have this new girl coming in,
Yeah.
he has a ton of experience and blah blah
Yes.
blah, so okay, like did you have that?
I did. Oh my God. My introduction is always like, oh, this is Sheila. She's got like 5 years experience in dialysis. She's new to the unit, but she's not new. She's got dialysis background. So I'm like,
Yeah.
okay, I set the bar high. Yes. But I think going back, I just answered humbly that, you know what, I learned different machine. I know what the dialysis principles are. I do know how to manage patient, but of course I still need to learn your ways, not my way, because me introducing my skills or like my knowledge into a different healthcare or background or unit is actually, it doesn't apply.
Yeah.
You know what I mean? Like, would you say in a way, like in a phrase, like, oh, this is how we do things?
Yeah, no.
No,
Especially
right?
if you're the newcomer.
Exactly.
But if they kept on introducing you that way,
Yeah.
I bet like the second day you should just introduce yourself as how to introduce. Hi, my name is Sheila. I'm new here, but I got 5 years of experience in dialysis elsewhere. nice meeting you.
Well, I don't say the 5 years, but
Yeah, no.
I would just say like I've got dialysis background.
Yeah, exactly.
So I know the principles.
Yeah. So even with my new workplace, I never mention unless they ask me
Yeah, true.
that I have experience in
Yep.
this kind of work setting.
Yep.
Although some of them would say that, oh, I've heard you're coming in with a ton of experience
Mm-hmm.
from this and you came from that. It's like, oh, okay. Yeah, look, but it's still in your workplace. I'm not
Exactly.
familiar with how you do things in here, so I'm
Yep.
like really eager to learn how you do it.
Yeah, true. And I think that's coming from a humble person. Like, you just gotta go around.
It's just kind of annoying because
When you get
obviously
introduced.
we're casual,
Yeah.
so like we get to see new faces every shift,
Mhm.
and it's like you have to repeat the same conversation again and again and again until
Yep.
everyone in the area knows about it,
Exactly.
and then from there you can move on to a different topic.
Yeah, exactly. Or the short talk if we're talking about. Anyway, what do you think are the pros and cons of this? Like, what do you think about bringing in your theoretical knowledge or your skills into the table, or what are the pros as well of resetting, like just reset button? Okay, I'm gonna learn new things, new skills. Is it?
Well, the pros, I guess, is you have that knowledge at the back of your head where in case something similar happens in this workplace, you would have a hinge of what to do. Like, for example, a medical emergency happens. So obviously we know like we have to follow a standard thing. Doctors say ABCD. And
Yep.
if you were doing it a lot back in your previous workplace, you're more comfortable in dealing with this kind of situation.
Yep.
Right? Unlike when you're a newbie and then you're starting and then you get exposed to those kind of things, you would usually get rattled. It's like, oh my God, what to do? Is like, I don't know. You have to balance out your fight or flight, which
Yep.
if you're a newbie, it would oftentimes not be flight.
Yeah,
Yeah.
exactly. Because you're scared, like, oh, this happened and I don't know what to do. You look super nervous and very, very like shaken
Yeah.
person. So what do you think also are the pros of resetting? For me, I think it's like you've got this not really an excuse, but I guess it's more of your pass card, is it? What's happening? Sorry, guys.
Can't tell us trying to bite the wirings in the camera.
I can. All right. So I guess it's this is a getaway pass or card that, hey, I'm new here. I don't actually no, but that's not always an excuse. Don't use it every time. But what I'm saying is you have that kind of card that you can just put out on the table and you can always ask. At the end of the day, they would understand that, hey, you're new here. You don't know everything.
That's the thing though. Because you were introduced as someone who had experience from
Exactly.
before, they would somewhat expect you to pick up things quite easily. So if you're on your third or fourth week and you still don't know how to do this, that, or something else,
Yep.
it's gonna fall on you though.
Yeah, true.
Yeah, for the lack of trying,
Yep. Yeah.
not for you being new here.
And I guess that's the con,
Yeah.
isn't it? It's a disadvantage of you having that background and then you not performing and delivering because it's gonna be, the feedback is gonna be on you, like literally, because you have no you don't put in the effort to actually learn things, rather than just saying, oh, I'm new here, I don't know things and I don't want to do anything. So anyway, second question, do you think you're being judged with what you bring to the table?
100%. 100%.
Me too.
Yeah.
I feel like people talk about you and they expect so much because of, they would say, oh, you've got extensive experience, and then they would expect you to really perform, but then you fall short because at the end of the day you don't know a lot. You don't know the things that happening in that specific unit or department. So right.
Yeah, especially with my attitude where I'm pretty much very hard on myself.
Same.
If
I'm so sensitive in that way. And
like I don't want to look dumb or present myself as stupid or lacking the initiative to learn things.
Yep.
So every time I would come out as that, like I would be really hard on myself. Where it's like, why didn't you do that? Like, why didn't you ask how to do this earlier, or why didn't you try to do it? Or,
Same. Remember, I was telling you last week that we had an incident that we're really short staffed, and that was on my second week of supernumerary, and that was actually my last day, and they expect me to take patient load together with my partner, and look, I guess in a way, like I'm quite comfortable taking a patient load, but the thing is, I'm not paperwork wise, I'm not signed off. So there's that patient safety that's going on my head, and I don't want to dismiss that, and I don't also want to come off like, hey, you just don't want to work, or you just don't, you don't want to deliver, that you said that you've got a lot of experience, and then people would expect me to do a lot of things.
Yeah.
But at the end of the day, I have to also look after myself, because if anything happens to my patient, that's going to be in my
yeah,
conscience.
especially that you weren't signed off yet.
Exactly. And I don't have the paperwork. And I guess this goes out to all new nurses, incoming nurses, old nurses. This goes out to you, because like you have to look after yourself. Patient safety is our priority. And we pledge to do no harm, and without those paperwork saying that, hey, you're competent enough to cannulate, you're competent enough to access a CVAD,
Even though you know that you are,
Exactly.
but there's some legalities into this thing.
Yep. So those are the things that you have to be professionally aware, and you have to be mindful of. So like, look, again, judge me that I'm not taking responsibility, but at the end of the day, this is my supernumerary. You can't blame me. And at the end of the day, I don't have the paperwork to prove that. So technically talaga, I'm still using, I'm gonna use that card.
But
Hey?
we usually, especially, I don't know, in our culture, we usually have this tendency to, especially if like third, fourth supernumerary,
Yep.
like we step up to the
Yeah.
to
We
the
step up to the
occasion.
task. And I did. Look, I took patient load.
Yep, without even thinking of the potential ramification in case something
Exactly.
happened. Sorry guys, another interruption by Ken. I don't know if
As
the audio is gonna
always.
be as good, especially he's been biting off the audio cable.
Yep.
But as you were talking about you taking the patient load,
Yeah,
even
I
in your supernumerary day.
Yeah, I did step up to the plate. I took 2 patient load. We only have 3, by the way, so which is great. But then at the end of the day, there's 2 patients that I looked after. Like I still have this reservation of me not having like the paperwork that would back me up with in case anything happens. But look, you know what? I've got some support, and I did document that, I'm supervised and all that sort. So I have to really back it up with my documentation. And at the end of the day, I'm sure I'm not going to implicate myself into something that I've done that would, harm patients, or if anything happened, that would cost me my license.
Yeah, I guess that's the only thing if we're new and we have to like do this buddy shifts. Like you don't want to come out as an extra baggage to carry for your partner. You want to
Be a burden.
as productive, as independent as you can, but again, be aware there's limitations to it.
Exactly. You don't want to be a burden, and you just have to know when to say no.
Yeah,
And know when to say
which
yes.
is really hard, especially if you're new.
Yeah, and exactly if they're expecting a lot from you. So yeah. Anyway, you have been on buddy shifts. Are you like, you have been in a lot of buddy shifts since not only just in nursing, also when you were in AIN. Are you satisfied with the buddy shifts that you're getting? Like, do you reckon that something needs to be like to change or develop?
Well, when I started my previous workplace back in ACT, I think there wasn't any buddy shifts because at that time you were paired up with a senior nurse to do your rounds.
Yep.
Because that's how it worked there. And then eventually you just had to do it by yourself without even butting up with anyone, like for the afternoon shift.
Yeah.
But then recently, just before, not before I left, but probably a couple of years ago, they started doing this supernumerary buddy, like a week of buddy shifts per area that you're going to, which was really good because that workplace wasn't for the faint-hearted, really.
Yeah.
So if you're uncomfortable in doing things, like you just won't be able to get over it. So it was good on them for
Recognizing
recognize, yeah. So at least it eased the staff's anxiety
Yeah.
in
What
functioning
would you
in
think?
the
Like,
workplace.
I should benefit from this too. When I was telling
Yeah. Look,
But
I was telling them like, oh, you're lucky that you're getting like 3-4 weeks of buddy shifts. 'Cause
exactly.
during my time, it was, yep, here you go straight, you go figure it out.
Yep.
Luckily though, in this new workplace of mine, I had 2.
Mm-hmm.
So I had one buddy shift for each unit
Yep.
that I was meant to be going. Although I would appreciate it more if there was gonna be more buddy shift for the other areas or the other shift, but then
It didn't happen.
it won't happen. I guess I'll just have to figure it out.
Exactly. I guess that's what we are, like resilient. Like we just cope and adapt and manage.
Because there are 2 types of shifts in there. I only got buddied up twice for that one specific shift, just in different areas.
Yep.
So I was kind of hoping I'll at least get one for that other shift. But anyway,
Yeah. Well, look, if you're interested, like you can express or like email them an expression of interest, isn't it? Like, hey, can I get a body shift for this specific
shift before
shift?
doing it. Nah,
Yeah.
because I already picked up a shift. That shift
that you're doing.
this coming. weekend.
Anyway, so I guess for me, like to be honest, if there's like a really nice flow of a body shift with a senior nurse, like they've also like organized something, because this is my next question. Like if I were buddied with someone, I would probably create like a flow of how I want to do things and how I want to orient them, because I guess that's like coming
like
from
a proper checklist to make sure you've covered everything.
and like this is coming from experience, because you've just brought out into a new area, and they will just show you things. That's it.
Yeah.
And then you figure it out the rest.
Yeah.
I'm like,
There's no actual sequence to it.
Yep.
Just how they do things as they know it every day.
yeah, true. But keep in mind though that this person that you're being buddied with, or your senior staff that you're being buddied with, they are not just like educators. They're also people with patient load. So that's also another dilemma in there, because it's not like you're the only one and they're not gonna just take your hand and hold your hand along the way. It's also them looking after patients without you making any errors, because you're the new person. So they're teaching you the new things and also teaching you the proper things, but then they're also looking after patients. So it's a bit tricky, isn't it?
I don't
do you
think
think?
that will ever change, because
Yeah, true.
again, they don't have extra load though. It's just the patient that
The
both of you will
Yep.
be looking after.
Yep.
So I guess
But sometimes, like, like you have to teach someone the proper way, say, for example, collecting blood, because this is in my experience. So sometimes you don't want to reprimand that specific person in front of the patient, and you have to show them the correct way before you let them do it. Does that make sense?
yep, I get what you
Because
mean.
of course, like for me personally, it's under my scope, and I don't mind having to buddy someone that's new in the department, and I would show them the ropes. But then I want to show them the proper way of doing things, and I don't want to show them shortcut, because you have to be a very keen and caring nurse to be able to do that. Because if you're just there for the money, then I don't think it's...
No, I guess that will fall under the educator's responsibility.
Yeah, but then again, if you're being buddied with someone, you better show them the proper way to do things.
Yeah.
Please.
But I guess it's a system that will never change.
That's so true. So how about you? Is there anything that you want to change? No, like if you're buddied with someone, like, is there anything that you want to have like constructively, so you be able to orient this person properly, or is there anything that you can think of? But because you're also having a workload, that consider that in mind. So you just want to show them.
The hard part is like because I lack the supernumerary, so I don't know anything better. Like it's like the way I was taught is the only way that
Yeah.
I know. Well, I guess
But over time
apart
you
from
improve though.
yeah,
And you build this pathway for yourself, or you build this steps for yourself.
well, I guess the one you cited was a good one, like putting everything in sequence. But I guess I don't know, just be patient.
Yeah.
Probably
true.
ask them
And be
like
kind.
what they know and what they want to know to begin with, and at least go from there.
Yeah.
And then
Sure.
just pick up bits and pieces along the way. I
Yeah.
don't know. I'm not really a good educator.
All right. So, but you're saying that in future, anything that you want to suggest though for you in the future, if you're, if you can be an educator, is there anything that you want to suggest to educators out there?
I don't know. Train me.
Yeah, true. Train us. But I guess like more so, I think we should learn from feedback mechanism as well. Like ask for feedback from your students or supernumeraries, like what can you improve on in the future, and maybe if you've got already this things in place, reassess them and see if it's working. If it's not, then how could you pave the way to actually better or transition them into the department easier?
Oh, that's a good one.
Yeah, isn't it?
Like if this method didn't work, like what are other methods can we make use of to
Yeah, true.
ease your way into the profession? Yeah,
Yeah.
that's a good. Especially me, I really struggle being assessed.
Mm-hmm.
Like even though I've done this 1,000 times
too.
before,
There's
I
always
just
that anxiety, isn't it?
I
And
just
fear.
hate the feeling of getting assessed. Like
That's why let's not do this again.
with my with my like my very first CDN in ACT before. Josie, if you're watching,
Oh,
like,
hi, Josie.
my hat's off to you. But she was really nice. Like she was wondering all the time, like, why are you anxious? Why do you get sweaty? I was like, I don't know. That's just me.
Exactly.
Yeah.
Same.
I was like, you know this. I was like, I know that I know it. It's just that I can't help but have this feeling that I can't explain. But yeah, it's just, I don't know.
I think coming from a non-English speaking background, you don't want to come off like you're communicating poorly because you're
Yeah.
translating everything in
Yeah.
your head, and then
You're having a hard time expressing yourself, although your body knows how to do it. It's just that whatever comes out of your mouth is not what you're meant to be.
and it's
saying.
usually the case,
Yeah.
isn't it? So I guess we should be easy on ourselves, though. I'm telling you earlier, I'm already anxious now. Like I'm going to work tomorrow.
Same,
But
yeah, same.
I'm already anxious of what's gonna happen. But I
Yeah.
guess it's a good feeling. Anxiety is a good feeling because that means you still care and you
Yeah.
don't want to mess up.
It means there's still something there for you to learn.
Yeah, exactly.
Yeah.
And you don't want to mess up your work that day. All right, coming into the new coming up to the last question. How would new generation of nurses value orientation or supernumerary? What do you think we can give? Because this is like an education, a learning experience as well for us. What do you think we can take away from that? What can we advise the new generation of nurses?
It's
What?
hard because during orientation, like my struggle is always not to fall asleep.
True.
But if your orientation days are interactive or it forces you to be interactive, I suggest like pay attention.
Yep.
Try to involve yourself as much as you can, because after that orientation, it's gonna be
it's gonna be you.
Yeah.
After your body shift, it's gonna be all you.
Yeah.
But I guess my advice would be, I always get excited like when it comes to new things happening. For example, like learning, being assigned to a new area, having the orientation and supernumerary. I always get excited. So always have that as well, because that means you are keen to learn.
Yeah.
And also be easy on yourself, because at the end of the day, these people are there to support you, and educators are there to educate you. So ask a lot of questions. If you're not sure, stop what you're doing and just ask first before you do anything. Because again, I always emphasize this patient safety is our priority. So yeah, and your safety as well. So anything
Definitely,
else?
no, your safety first. Actually.
Yeah. Anything else you want to add to that?
Try not to fall asleep during orientation days.
But look, they tried to make it as interactive as possible, guys. So you be right. Good luck on your new job, possibly new area or new workplace that you're gonna go to, and all the best. And congratulations for landing that job, guys. Hopefully you get a takeaway out of this. Let us know what you think. If you had your orientation or supernumerary, comment down below. Please don't forget to like, share, and subscribe. And anything else?
Now, again, I'm Ruel.
And I'm Sheila.
And this is the
CommoNurse Podcast.
Till the next one.
Bye.